Depending upon the cause of hypothyroidism, it can be a primary disease or the secondary disease. Now, what is the difference between the primary and the secondary hypothyroidism that we are going to discuss here? Look at this diagram. This is telling you about the normal physiology of hypothyroidism, the normal physiology of thyroid hormone, how it is released, and we have discussed about it. Now, I told you the three main reasons of the hypothyroidism or the thyroid gland disease. There can be some defect here in the thyroid hormone. There's some kind of the intrinsic defect, congenital defect that lead to the decrease in the production of the thyroid hormone. There can be some defect here in the pituitary gland that can lead to a decrease in the level of the hormone, and there can be some defect here that can cause disease, some central defect. Now, depending upon these three type of the causes, what is the primary disease and what is the secondary disease? Basically, primary disease is when the defect is here in the thyroid gland. That's mean primary disease is when some intrinsic causes are causing the disease, like there is some autoimmune reaction, some autoimmune disease, there is some viral infection or the bacterial infection that is causing the disease, or there is some congenital developmental defect, genetic defects, or iodine deficiency. All of these things comes under the heading of the primary disease. Also the drugs that cause the thyroid hormone disease. Then there is the secondary disease that is due to the secondary causes. Secondary causes means that the causes other than the intrinsic causes, including the thyroid stimulating hormone and the thyroid regulatory hormone, including the central nervous system diseases, the disease of hypothalamus or any other disease, and the pituitary gland diseases. And again, the secondary cause or the secondary hypothyroidism is much more rare as compared to the primary hypothyroidism. Now let's see what are some major causes that cause the primary hypothyroidism. As I told you that secondary hypothyroidism is rare and there are only two causes that can lead to the secondary disease, on the hypothalamus disease or the pituitary disease. Then there is in the primary hypothyroidism there are a number of causes, including the thyroid dysfunction. Now, this thyroid dysfunction can be due to the autoimmune thyroiditis or Hashimoto's thyroiditis. Now, in this type of disease, what happens actually, the antibodies are being produced inside our body against the thyroid gland cells. This causes the death of the thyroid gland cells and ultimately cause a decrease in the production of the thyroid hormone. Then there is a congenital absence or defect of thyroid tissue. Now, that can be due to some defects during the development of the thyroid gland, due to some genetic defect, and also due to some deficiency, iodine deficiency in the mother as well. Then there can be thyroid removal by surgery. There can be some prior disease that lead to it that cause the or that need the removal of the thyroid gland, and because of this removal there is a decrease in the thyroid hormone and the patient is suffering from the hypothyroidism. Then there can be the radioablation by radioactive iodine or irradiation that can also be a reason of thyroid gland disease or hypothyroidism. There can be the destruction of thyroid tissue due to infiltrative disorders. Infiltrative disorders like sarcoidosis that can lead to the destruction of the thyroid tissue or the thyroid cells. So when the cells are destroyed, ultimately they are unable to produce the thyroid hormone, whatever the level of the thyroid stimulating hormone or the regulatory hormone is. So this will cause a decrease in the level of the thyroid hormone. Then there can be the impaired synthesis of the thyroid hormone. Now, thyroid gland is functioning properly, the cells are normal, tissues are normal, but there is still the impaired synthesis of the thyroid hormone. This can be due to the iodine deficiency. That is the most common cause. Now, iodine deficiency can be because of your less intake of the iodine in the food, or it can be due to some other causes as well. Then there can be the congenital enzymatic defect that can lead to the impaired production of the thyroglobulin or decreased level of the iodine, and the whole mechanism of the production of the thyroid hormone and the different enzymes that are involved in the production of the thyroid hormone, they can be deficient, or they are not produced. That can lead to a disturbance in the production of the thyroid hormone. Then again, the drug-mediated disease. Thionamides and lithium is the most common drugs that can cause the hypothyroidism. Mostly the drugs that are acting on the central nervous system, like the drugs that are used to treat the mania, depression, they are the causes of the hypothyroidism, and they lead to a decrease in the level of the hormone inside our body. Apart from that, there are some agents in our food, in our diet, inside our body that can also cause a decrease in the level of the thyroid hormone when they are in excess. So all of these things should be considered when diagnosing the disease or when discussing the cause of hypothyroidism.